Happening now in Medical Matters, influenza, or the flu, is already popping up in central Mississippi. Today, we're happy to have with us Dr. Timothy Quinn to talk about flu prevention. Thank you so much for being with us. We were talking about the fact that we've got about 9 Florida football players who have the flu. They've come down with the flu, and we've had reports popping up in the metro area. What is the best thing you can do to protect yourself?
Well, the best thing you can do is get your flu vaccination. And it works. I mean, the deal is the CDC, they come up with the formula to match the last year's and if you get your flu shot, there's a good chance that you won't get the flu.
There are a lot of myths out there, and some people say, I didn't get the flu until I got the flu shot. But you really can't get the flu from the flu shot.
You can't. Basically, the flu vaccination or the flu shot is just the antigens from the flu virus that do not cause the flu, but they cause your body to produce an immune response. So if you come in contact with the flu, you can fight it off. It takes about 2 weeks, but you will not get the flu from the flu shot.
Is now a good time to get your flu shot? I see the signs going up at a lot of the pharmacies saying you can get your flu shot here.
Right now is the best time because it takes about 2 weeks for the, your body to produce the antibodies to fight off the flu. So it's recommended, during the month of September because October is full-fledged flu time and all the way through May. So it's a good idea to go ahead and get it now.
What about children? How old should a child be when they get the flu shot?
Start at 6 months. The flu shot is recommended. And if they're 2 years old, they can even get the flu nasal mist. And they don't have to get the shot. So that's an alternative. And the deal is most insurances, they pay for the shot and the mist, so you don't even have to have any out-of-pocket expenses.
Most people don't know that the flu can be deadly, especially when you're talking about young children and the elderly.
Yeah, exactly, because when you get into young children or elderly, you come across a lot of people that are immunocompromised, meaning they can't fight off infections like a younger person can. So you want to get the flu shot not only to protect yourself, but if you get the flu shot, such as myself, then I have patients that are immunocompromised. There's a chance that I won't give them the flu to serve as a carrier. So it's important to get that shot for everyone.
Now, let's talk about some of the symptoms. And the flu varies with different people, but most of the time, doctors do a swab, or how do they find out exactly whether or not it's the flu, or if it's sinus infection, cold, or what is the difference?
Well, the flu is mainly diagnosed just by the clinical presentation, the symptoms. You have the runny nose, the itchy eyes, the coughing, the sneezing, the body aches. All these things will push us toward a diagnosis of the flu. But if you want to get a confirmation, most clinics such as mine, we can do a test in the office where we do a nasal swab and we use a reagent and it'll tell us if they have the flu right then on the spot. But some clinics don't do the test, they just go off the symptoms, and in most cases they'll go ahead and prescribe the medication, and Tamiflu is the most common. But here's the deal, you have to start the medicine early. If you start it after 1 or 2 days, say 48 hours, it has some effectiveness, but it's not nearly as effective if you can start it in the first couple of days and it can go ahead and give you some relief. And
doesn't that shorten the time that you have the flu as well? It not only does it help give you some relief, but I know people who haven't gotten the Tamiflu and it seems like it takes them forever to get over it.
Well, if you're somebody that has a good immune system, you can fight off the flu. But what the Tamiflu does, if started early within the first 48 hours, it can really help your body to fight it off so you can go ahead and recover. And then I go back to saying if you go ahead and take the medication, you won't be having the flu to expose other people in your community.
Well, can you get the flu more than one time in the same year?
It's possible because there are mutations of different strains, so you might get one strain of the flu and build up the antibodies, but you may get another strain. And that goes back to the flu vaccination because, as I said, they make the vaccination from the most common strains the year before. But if there's a mutation, you can get the flu shot, but you can still get the flu because you might be exposed to a different strain. And I think that happened about a year ago where there was a whole different strain, but it's still recommended to get the shot because it does give you some protection.
Now, let's talk about the pneumonia shot as well, because a lot of people, when they get the flu shot, they go ahead and get the pneumonia shot, which is good for about 5 years.
Right. And the pneumonia shot is recommended especially for our elderly population because there's a higher prevalence of lung disease and heart disease, which makes them more vulnerable to get the pneumonia, and for that population it can be deadly.
Well, thank you so much, Dr. Quinn, for being with us today. And if anyone wants to talk to you, how can they get in touch with you? Your clinic?
They can call my clinic, or they can just go to our website, quinnhealthcare.net. That's quinnhealthcare.net, and we have a lot of information and contact information so they can call us and maybe we can help them.
All right, thank you again.
Thank
We've been
you.
talking with Dr. Timothy Quinn.